My name's Cat Edney, welcome to Greenwich Dental Health. My name's Cat Edney. I'm a dental hygienist and therapist working in private practice in Greenwich. I'm really interested in seeing dental hygienists and therapists use their full scope of practice and be able to utilise their skills to help their patients in preventative measures but also in restorative measures. I think practices should really use a digital scanner because it is the ultimate in the communication tool for our patients. Being able to show our patients a visual of their mouths in high definition right there and then in the room while they're having their consultation just opens up a whole world of opportunities to be able to communicate with our patients, explain to them what's going on in their mouths and make sure that they really have a true understanding of what they're facing with their dental health. I really believe that education is the basis of prevention in dentistry, and that's why really when practices use scanners they should be able to use them from the very start of the consultation process throughout their treatment process with their patients. So using the iTero digital scanner really improves my patient communication. I have an ambition to scan every patient that comes into my surgery, and what I do is a descriptive exam, so I will go through scanning every tooth individually and explaining to the patient what I can see, and I'll make sure that I position the scanner so the patient can see the screen as well. The reason being that it just really improves their understanding if they can visualize their mouth and their teeth. You know, if there's an amalgam filling with a small fracture, or we often find that a little bit of enamel is missing around the outside, they can now see what I'm talking about. Patients that I've been seeing for years in the past who haven't wanted to replace restorations or have been leaving areas that we've been saying, really, we need to start thinking about doing something about this, they're now engaged and willing and interested in fixing their teeth. So I believe that every consultation should start with a scan, and the reason I feel that way is because having a scanner is a really fantastic communication tool with our patients. We can get a patient in and be able to show them so much information about their mouths. It's bringing the patient into the conversation. We can connect with them on a completely different level. When I scan my patients, I like to do a descriptive examination. So I will ask them to look at the scanner and I'll ask them to look at every single tooth that I'm scanning, and I will explain to them what I'm seeing. So I might not say a medial occlusal amalgam, I might say you have a big silver filling on the front surface and the top surface of this tooth. And this is just a really great way of educating my patients as to what's going on in their mouths. As that scan progresses, the patient is often asking more questions, engaging, more interested in what they have to talk about with their mouths. We would then use different tools as the scan and the appointment progresses. So I may then use a tool to be able to look at the way they're biting together. We might be able to look at their occlusion and see if there's any hard spots or high spots. We can also look at things like misalignment, if there's any tartar, calculus, inflammation, and this is just again adding to the education for my patient. Patient comes into me, we have a few tools with the iTero scanner that we like to use and show them during their appointment. One of the really interesting points of the digital scanner is we can use a time-lapse tool. So when every patient comes to your practice and has had a scan, if they then come back, you'll be able to use the two consecutive scans and be able to see if there's been any changes. The time-lapse tool is a really fantastic way of understanding if wear is progressing, if there's any erosion that's getting worse, if inflammation has improved, but also if a patient feels that there might be something different about their mouth, you'll be able to confirm or deny if there's been movements or changes. The other tool that we use is the occlusogram, being able to look at patients' bite and any areas that might be liable to wear or fractures. And also I really enjoy using NIRI technology in order to look at our patients' teeth and visualize the structure of the tooth and understand if there's any interdental, interproximal caries forming on our patients before we've even had to take any radiographs. So the reason that I feel that the whole team should get involved in using the iTero scanner is that quite often when the scanner is left in the dentist's surgery and it might only be used for Invisalign or the odd restorative case, the patients aren't getting the full digital experience. When a team starts taking the scans of every patient in the practice, you find that more patients become engaged, perhaps patients that have been written off in the past. You can also use these scans for so much more than just a restorative case or promoting Invisalign. You're using it to show the patient that you really care about their oral health and the future of their mouth. So NIRI is Near Infrared Imaging Technology, and the most amazing tool that I love to use with my iTero scanner. What NIRI does is it allows me to visualize the structure of the tooth, but also if there's any interproximal caries starting to form on my patient's dentition. It's 60% more sensitive than radiographs, so those very early initial lesions that we can fix and we can improve just with better oral hygiene or maybe with minimally invasive resin techniques, we can now educate our patients on without having to take radiographs. Using NIRI means that I can educate my patients, perhaps to perform some treatment, and then scan again to be able to monitor, see whether or not the treatment has worked, but also see if the patient's home care has improved their outcomes. For a dental therapist, digital dental therapy is such an exciting prospect. Not only does it aid this communication with my patient, but also there are so many things that I can do for my patient having had the scan. So we can check misalignment, we can check occlusion, we can have a look at recession, we can also monitor the progression of any lesions or recession or concerns that we have with our patient's teeth. But also having that scan means that I have a record of my patient for the future. I can go back into my iTero and have a look at my patient's scans later on. It's fantastic for planning. And I can use that scan as well to discuss with my colleagues and communicate with them what kind of treatment it is that we think maybe this patient would require. Having a scan of my patient means that also they don't need to come back for a records appointment if we decide they do want to progress with any treatment. It means that we're reducing surgery time while also still having a fantastic record of our patient that we can plan with without them necessarily needing to be in the surgery. The other thing I like to do at the end of my appointment is close that appointment with the wow factor. I like to show my patients the Invisalign outcome simulation just so they can get an idea of what their teeth might look like if they happen to decide to have Invisalign. Patients often whip out their phones, want to take a photograph of what their teeth look like straightened, and quite often I find that they're talking to their partners. So even if they don't come in and decide they want their teeth straightened, their partners, their friends and their colleagues often do. If my iTero scanner was taken away from me tomorrow, I would feel such a great sense of loss, but the loss would be mainly for my patients. I think, you know, the iTero scanner can be used for such exciting things like Invisalign and restorative cases, but most importantly, it's for the communication with our patients and for patients to miss out on that amazing experience where they understand their dentition and are able to really visualize what's going on in their mouth would be such a shame. I really feel that education is at the heart of preventative dentistry. I really couldn't imagine now working without my iTero scanner. I would be lost without it.